Oh, hi everyone, it's Pete here from the Pain Toolkit, and I'm with a very good friend of mine, Blair Smith. Good morning to you, Blair. How are you today?
Morning, Pete. Great to see you. I'm fine, thank you.
It's good to see you, man. Hey, listen, myself and Keith Melton, we was doing this tweaking the Pain Toolkit. It's going to be like a Prehab Pain Toolkit because we're looking at ways on what seems to happen with healthcare. It's like or we have a procedure or have an operation and then you have rehab. And I've been hearing this term prehab for quite a few years now, thinking, well, are we missing something out here? Why don't people,
hmm
if people can have a procedure or an operation, perhaps they could be tapering off medication or opioids or something, or they're about to have cancer treatment and whatnot. What about getting in, doing some prehab first, where they learn some pain self-management skills prior to
Yeah,
start the treatment? I mean, what's
yeah.
your take on it?
Well, I think it makes enormous sense. I think, as with pain medications, actually, people tend to be encouraged to rely on the procedure as the only thing that happens. It's the only thing that contributes to the cure, but it's not. There's so many things we can do for ourselves, and we need to do for ourselves. I mean, the procedure is just, if you take it to its simplest, it's just about getting you into a position where you can live your life closer to the way you want to do it. And it makes sense, therefore, to go in to that procedure as fit and in as good shape as you can, so that after the procedure's over, you can then hit the ground running and take off.
So I know part of your job is like you do your are you like the I don't know, perhaps that's the wrong word. Is it the Tsar Pain Tsar in Scotland?
I've
What
stepped down, handed over to a very competent colleague to the last year or two to do that.
Okay, so but you're to me as far as I'm concerned, you're like the head was the head honcho in Scotland. I mean, what happens in Scotland regarding prehab? Is it a big deal up there? I mean, do they
Prehab, I think, is a term that's beginning to enter the consciousness, but I know you were talking to another colleague in Australia where it seems to be big news. I don't think it's big news yet, but I think we could certainly do with it increasing in awareness
mm.
and importance.
What do you think? I mean, we're looking at how prehab could be useful for, perhaps
Yeah,
as you said earlier on, prior to a procedure,
yeah,
um, an operation, and
yeah,
especially for cancer. I mean, myself, really,
yeah.
I said in the other interview with Toby that when I got diagnosed with cancer, that
hmm
I asked about, because with any when you have any sort of treatment, there's
Yeah,
maybe some sort of after or
yeah,
effects you get from it.
yeah,
And they just said it affects your bones in some way because I'm having
yes,
hormone treatment for prostate cancer.
yes,
So I thought to myself, right, well, okay, well, what do I need to do?
yeah,
And they was a bit vague about it. I'll be honest with you. I
hmm
always remember one oncologist told me, "Oh, eat lots of tomatoes," but there's something there. But being a self manager, well, what?
yeah,
How can I be more proactive? And I
yeah,
found out that we got to tweak your for me like
yeah,
exercise program, etc.
yeah,
And I mean that's the good thing about being a self manager is that it's not you learn about one like as I did back in the day, learn how to manage pain, but it's all those self management skills are universal, really, aren't they? I mean, uh,
yeah. I mean, cancer surgery or any surgery, any major surgery is one area actually where they're beginning to uh, emphasize prehab a bit more. And you're right. So particularly going for major surgery, and as you know, I've been through that as well. Um, you're going to have effectively a major trauma. It's equivalent to having major trauma, or it. I mean, thinking about it, we've just finished the Six Nations rugby tournament here, and what a fantastic tournament it was.
it was.
For every individual going into an international game of rugby, it's equivalent to going into an RTA and coming out and being expected to stand up and walk away the next morning. Not a single one of those players doesn't go in absolutely anything other than completely peak physical and mental condition, and spend a lot of time preparing for that, and they just wouldn't be able to do it if they weren't. I think it's exactly the same if we're going in for surgery of any sort, but particularly major surgery that's going to leave you prostrate the next day. And there is a movement to try and encourage physical fitness. Like you, when I heard I was going to have to go in for surgery, I started increasing my fitness and stamina so that I was in as good a place as possible. And I think the result was that I made a much quicker recovery than I otherwise might have done. And I would certainly, I hadn't until then recognized the benefit of prehab. I just did that instinctively, but then afterwards started reading up about it and thought, well, this is really important concept, and we should be encouraging all our friends and family and patients who are going for surgery or any other procedure to get themselves in as fit a position as possible so that they can walk away afterwards.
Yeah, I totally agree with the I mean, I've got people I know around living here, like a guy's having a new hip, no, another hip replacement.
Yeah,
He's already had one side, he's having the other side done. But
yeah,
they've given him a load of stretches and exercises to do pre and to
yeah,
the operation, etc. And
yeah,
that's what I'm hearing with this pre-ad thing. When I because like you, I started digging a bit deeper, and that term always seems to come out a lot where it's if you do some pre-ab, then your recovery will be it won't be it'll be shorter than
yeah.
what it was if you left it till after the procedure, etc.
Yeah, and it's also about prevention, isn't it, Pete? So we all know that one of the times when people are at risk of starting a career of pain medication
Mm.
is post-procedure, it's post-operative. So they come out of the surgery, they're given morphine, and they're sent away with strong analgesics, and often they're not reviewed and given the opportunity to come down from those opioids, and we find that they're still on them 6 months, a year, several years later. If they go in, if we have the mindset that this may not be necessary, and educate ourselves about the post-operative analgesia, post-procedure analgesia, or the need for pain relief afterwards, and the benefits of tapering down. And if we get ourselves as fit and strong as possible so that our need for analgesia is less than it otherwise might have been, then we're giving ourselves the best chance of long-term health and prevention of chronic pain and prevention of the need for long-term strong pain medicines, which can only be a good thing.
Blair, it's most of the emails that I get from people,
Hmm.
they're mainly about medication, etc.
Right.
And quite a few of the emails say they don't want to be on it.
Sure.
It's not working, but there isn't, there's not, they've never been meant, like whoever they're, the doctor or healthcare worker they're under.
Yeah.
Self-management has not actually been mentioned to them, sadly.
Yeah.
Um, but I don't, to me, I'm not in a blaming mode because to me, I think, the drum I keep always beating is that if you take, healthcare professionals need to be taught self-management while they're in med school, etc. Like, not
Yeah.
just
Yeah.
doctors, but physios and OTs and whatnot.
Yeah.
But it just seems to be, I think it's getting better,
Yeah.
but it needs to get that process needs to speed up where self-management is included in their curriculum, so
I think it's a culture shift, Pete. I think when I was at medical school, our generation, and when I was training as a GP, first of all, our generation were kind of brought up with the expectation that the outcome of any consultation was a prescription, and we expected to do that, and patients expected to come away with a prescription. It's begun to change, that we look for alternatives. And even if it is a prescription, it might be a prescription for exercise, or a referral to a gym service, for example, or a talking therapy. But it's still an expectation that that's the outcome, and that people come to us to be told what to do and go away and do that. Whereas it should really be a dialogue, and we should expect that, and people coming to healthcare professionals should expect and be allowed to do that. And I think that's where a lot of this comes from, where the healthcare professional facilitates the management
Yeah.
with whatever skills and training that they have,
Mm.
but that it's the patient, if you want to use that term in that context, who uh, has the power to determine what is the best management for them and how they can make the best of the condition that they have and the life that they have with that condition.
So I think that we use the term self-management. I think a lot of people um, wouldn't know what that meant. I know it sounds a bit odd.
Yeah,
In recent years, we've had to use included that term, so supportive self-management, so
yes,
they get the idea that they're being supported by their
yeah,
healthcare team, etc. But I think a lot of people know they're already self-managing, but they don't know
yeah,
it. That
that's
term,
right. That's
like
right.
brushing your teeth and stuff like that. I often say to you, you brush your teeth. Yeah, well, why do you brush your teeth? Well, keeps them clean, you know. Said anything else? Well, while they're clean, I don't have to go see the dentist so often. It's the same thing, isn't it? So you're
Yeah.
doing some sort of self-management there, where you're brushing your teeth, etc. No, and it's a form of sort of self-management.
So I think the important word there is supported, because the danger is if people come to the pain service where I now work as a consultant and I say, well, there are no more medical options. You've tried all the medicines that are available. There's no surgery that the surgeons have been able to offer you, which leaves us with self-management. If we aren't careful in how we describe and present that, then it can sound a bit like off you go, you're on your own.
That's what they say to me. They say, it's like I feel like they're being cut loose, like
Yeah,
it's the end
yeah,
of the road, and you go and sort yourself out. And I don't know. Well, people go and do as I did back in the day, loads of doctor shopping and therapy shopping and
yeah.
stuff like that. So yeah,
And even if we are introducing a new medicine, then I would try and say that the purpose of this medicine is to enable you to be better at self-management, because it gets you over a hump perhaps and allows you to
yeah,
go for a walk, do your exercise, whatever it is that we're
yeah,
suggesting they do. And I think it's the same with prehab, which is what we were saying right back at the beginning, that the intention of any pain procedure, so if we talk about maybe an injection treatment, the intention isn't to completely cure the pain so that they get a normal life. The intention is to enable them to be better and more able to self-manage the condition, which they still will have at the end of the procedure.
Well, Blair, I think we've covered quite a few bases there. Have you got any take-home messages before we go?
Um, I hadn't prepared a take-home message, but I would just say that whatever a healthcare professional is offering you as their treatment, it's to support your own self-management, and therefore self-management and prehab before any treatment or operation is more important than anything I as a doctor can give you usually.
Well, thanks again, Blair, and I hope everybody got a lot from that, whether you're watching a video or listening to an audio. Thanks very much for tuning in. Don't forget to see all the other videos that are throughout the Prehab Pain Toolkit. Again, Blair, thanks very much. Have a nice day. And
My pleasure. I look forward to recommending the Pain Toolkit to all my patients, from as I always do.
fantastic. Take care, man. Have a nice day.
Bye bye.